Good morning, everybody. Excited to be here, excited to speak about a topic that I really have grown to love. I find these molecules to be amazing. It is definitely an introductory talk because there's so much that we could discuss when it comes to peptides. So disclaimer, of course, this is not medical advice, can't be held liable for you doing anything unintelligent with peptides, informational only. And it's really a brief talk, I've gone to some training courses where we spend 2-3 days speaking about peptides, so this, obviously with the time we have, can't go into everything. It is important to know that a lot of the peptides we're going to discuss aren't FDA approved. Some of them occupy this kind of murky regulatory space when it comes to the FDA. So, like I said, an overview, we're going to give some definitions, we're going to talk about some broad categories, how they can benefit us, we'll talk about some of the evidence, the real importance of not neglecting lifestyle, answer some questions, talk about access, use some cases as examples. So, what exactly are peptides and why are they all the rave right now? Basically, peptides, they're a group of molecules. You could say proteins, you could say hormones. So a lot of times people think they're this magical thing, but they really are molecules that exist in our body already. And what they are is that you can think of them as very small proteins. So they're blocks of chains of amino acids. In general, they tend to be shorter chains. A protein is usually more than 100. A peptide is around 50. But their main role is that they're signaling molecules. So what they really are, as I said, they're speaking in a language that our body understands, and they bind to known receptors in our body. Most of these can be found in our body, and they're very short acting. You could think of them like a Snapchat message. I've never really used Snapchat, but I know that when you send a message, someone reads it and then it's gone. So peptides work in a similar way. So they kind of send a message to the body, to the cells, and then they get broken down very rapidly in the bloodstream. So they're not, in general, metabolized by the kidney or the liver, which is good because we're not running into issues with toxicity. And what's really important is that they maintain our body's own feedback loops. So you're never going to get these really unnaturally high signals if done correctly. Since they are such small molecules, many of them are broken down by the stomach. So most of them currently can't be taken orally, although that's starting to change. So peptides have been around, and we discovered them well over 100 years ago. Probably the most well-known peptide is insulin. It's been used medically, obviously, for more than a century. Glutathione is also a peptide, very important molecule. But not everything that we inject is a peptide. So a lot of times people think NAD is a peptide because they're often marketed together, but it's not. NAD is this important coenzyme. It's an electron donor in our mitochondria. It's important for energy and longevity, but not a peptide. 5-amino-1-MQ is another molecule that people associate with peptides. And this is a way of raising our body's own NAD, but also not a peptide. Things like HCG and other injectable, definitely not a peptide. So why are we starting to hear about this now? Well, as I said, they've been around for quite a while. Many of them have been discovered long time ago. In other countries, especially Russia, Eastern Europe, Asia, they're really much more widely utilized and approved by their governing bodies. The bodybuilding world and the gym bros have been using these for quite a while. And in essence, they've kind of been our guinea pigs because they've used them in doses that most of us wouldn't recommend without really any negative safety signal. The biohacking world has been using them for quite a while, but it really was the celebrities with the advent of Ozempic that really brought this to the popular consciousness. What can they do? I mean, there's a lot of overlap. Some of them help many different processes, but I've created these categories of things I'd like you to think about. So we can use them for repair, for the immune system, for our brain, for sleep, for longevity, for sexual health. We'll spend a lot of time talking about how they can impact metabolism. Ultimately, there's really 3 key things that happen to our bodies that really lead to a lot of problems. So we see chronic inflammation. We see a lack of energy production, so our mitochondria start to decline, and we see a loss of ability to listen to insulin. So those 3 things really underline almost everything. You could apply them to cancer, to neurodegenerative disease, to heart disease. So by being able to address these key failures of biology, we can really support our health. All right, so this category is repair and recovery. The first one on the list is probably one that most of you, anyone who's started to dabble in peptides has probably heard about this one, but we're gonna discuss all of these. So BPC-157, that stands for Body Protection Compound. A lot of people call this the Wolverine or the healing peptide. And this is an incredible peptide. It's made in our stomach, in our gastric contents, and it heals all types of tissue: tendons, ligaments, bone, muscle, even the brain, the lining of our GI tract. And again, it's made naturally, but like many good things, it starts to decline with age. And what we see that it does is the way it works is that it increases our circulation, it stimulates stem cell production, helping us to regenerate. It's a potent anti-inflammatory, it turns up growth hormone, it heals the lining of the gut, and it has so many different benefits. The way it was discovered, the reason I have this picture up here is Dr. Pavlov. I don't know if you guys have heard of Pavlov's dog. And so he did a lot of these studies on operant conditioning. And one of the things he did was he found a way to extract cleanly the gastric gastric juices of dogs while he was doing these studies. And for some reason, he decided to take this gastric juice and give it to patients clinically. And he found that it helped heal and treat ulcers, heartburn, anemia, improved appetite. But it really wasn't until about 1993 that the compound that does all these things was isolated, and that's BPC-157. So it can be given lots of different ways. It can be injected subcutaneously, which is the most common way. It can be injected directly into a joint, or it can be taken orally if we're targeting the gut. And where we're targeting the gut, it's often combined with peptides like KPV or lorazepatide, and these are amazing at helping to heal the gut lining, the infamous leaky gut that a lot of you have probably heard about. So another repair peptide is something called TB4, thymosin beta-4. So this also works on multiple cell types. It's actually found throughout our body. The only cells that don't have it are the red blood cells. And a lot of overlap with BPC-157. It speeds healing, promotes new blood vessels, improving circulation, promotes stem cell maturation, inflammation. It's also a very potent anti-scar tissue. So it helps protect people who are at risk for lung scarring, kidney scarring, heart scarring after a heart attack. A lot of people call it the Swiss Army knife peptide because it can do so many things. An easy way to remember, I think of TB as tissue building, and it helps build. But we don't always want to be building, and so this underlines why we're not always just relying on one type of signal. We need to intelligently toggle back and forth. So TB4 is the naturally occurring peptide that's already within our body. TB500 is the synthetic fragment of TB4. That's usually what you find in a lot of peptide blends now. And that supposedly is targeting more the musculoskeletal system. But because TB4 can do so many things in so many organs, we can use it so many ways. We can see its use in ophthalmology, in the eye. It can help, as I mentioned, kidney, lungs, and liver. It helps fight a lot of infections. Protect the heart, protect the brain, very good at helping the skin heal as well. GHK copper is another common one that we see in this repair and recovery. This is oftentimes synonymous with the skin health, skin peptide. This is in a lot of cosmetics topically. So this is another amazing peptide that our body makes, but of course declines with age. And it's very important for skin anti-aging. So it helps improve the circulation to our skin, it helps improve our skin's elasticity, and it really reduces the causes of aging of skin. It can really help a lot with wound healing and hair growth, even longevity. This is one of the few peptides that actually hurts when oftentimes it burns at the site of injection, so that's important to keep in mind. And our body is really all about ratios, and so copper and zinc are held in this very important ratio. So if you're taking a blend that has too high a dose of GHK copper, you could throw off those ratios. So I usually tell people to take zinc while they're on it. And you really, because of these reasons, shouldn't take the injectable form of GHK copper for more than 4 weeks max. But the topical versions can be taken much longer than that. All right, let's talk about a case. So this was a 56-year-old female that I saw at my hyperbaric clinic. She said that she was a former smoker, but that meant sometime smoker. And so she had a tummy tuck, which is where they remove the excess skin, tighten it up. And at that site, she developed problems with circulation, likely due to her smoking, and that caused necrosis, tissue death. So we treated her for about a couple weeks. And so what I started her on, because the progress was slow, was this famous blend that a lot of you may have heard about. It's called the Glow blend. So there's a combination of the last 3 peptides I just spoke about. And so after we started her on that, we saw that really within 4 weeks of using the combination of hyperbarics and peptides, she had significant healing. Another case, this was a athlete. This was a gentleman who's a very active triathlete. He was playing basketball over the weekend, tore his Achilles tendon, the famous weekend warrior injury. And so he wanted to heal, most importantly because he was competing in a triathlon in a few months. So in addition to hyperbarics, we combined BPC 157 and TB4 along with CJC ipamorelin, which we'll talk about. His physical therapist was blown away by his recovery. He was able to compete in his triathlon and had a personal best record. All right, so the Wolverine blend is another blend that's out there. It's the BPC 157 combined with TB 500. And this is great after injury, after surgery. It also helps just with the daily aches and pains that come with pushing our body. It's named after the Wolverine animal isn't really regenerative, but the Marvel character is, of course. But really, if we wanted to look to nature to find an animal that regenerates, we got to look to amphibians. So the axolotl is this cool animal that you can cut off an arm. It'll even regenerate an organ without any scarring. So we really should call this the axolotl blend, but doesn't quite sound as good. So. The last category within this repair is the growth hormone peptide. So growth hormone, as the name implies, triggers growth. It encourages growth through stem cells. It increases our muscle. It helps us burn fat more efficiently. It's really important in our brain health and sleep. It actually lowers the risk of cardiovascular events, so less heart attacks, less stroke, and like many good things, declines with age. So by the time you're my age in your 50s, it's a fraction of what it was. And so this explains a lot of the changes we see with aging. We see increased fat, especially around our organs. We see loss of muscle mass. It's harder to maintain muscle. We see a rise in a lot of these cardiovascular events and overall poor metabolic health. But the problem with just taking growth hormone is that, first of all, it shuts down our body's own production of hormones. So when you bring in a foreign large amount of growth hormone, our brain says, okay, stop making growth hormone, which is not good. We also see risk with increased diabetes. And because of these things, growth hormone is very tightly regulated. And so this is one of the few prescriptions that if I wrote and I didn't have right criteria, I could actually go to jail for. But enter the growth hormone releasing peptides, you avoid a lot of the problems. It's much safer than growth hormone because what these do is they tell our own brain to release more growth hormone. So very different than using foreign growth hormone. And it can act on different areas of the brain depending on the peptide. But the best thing is that the feedback loops are preserved. So you're never going to get too high and you're never going to shut down your own production if done correctly. Now we've got a bunch of different peptides that are in this category. The oldest one is ceramorelin. Then we had CJC 1295. And then the latest one within this class is tesamorelin. And each one binds a little longer, has a little more potent release of growth hormone. And so, and ipamorelin actually binds to another receptor, also helping to raise growth hormone. So oftentimes you'll see CJC mixed with ipamorelin, tesamorelin mixed with ipamorelin, just to increase that growth hormone signal. So what does growth hormone peptides do for us? Well, a lot of the benefits of growth hormone. So we see more muscle, we see better fat burning, we see improvements in energy, cognition, sleep is an often kind of neglected benefit of growth hormone because growth hormone helps put us into deep sleep. And so it is very important to cycle this growth hormone. This is one of the few peptides that you could mess up if it's not done correctly. In general, I tell people to do 5 days on, 2 days off, no more than 12 weeks at a time. You also want to time it because our body releases growth hormone during deep sleep. So you want to do it right before bed and you need to separate it about an hour after the last meal. So because tesamorelin, I didn't mention this, is actually FDA approved. It's FDA approved for something called HIV lipodystrophy. With HIV, you can get abnormal fat deposition. So it's been approved for quite a while, and because of that, we have a long track record of studying it. Because one of the natural concerns anytime you're stimulating growth hormone would be, all right, is this going to trigger cancer? And we have lots and lots of studies showing that growth hormone itself is not associated with new cancer, and neither are any of these growth hormone peptides. So that's very reassuring. I like to think of things, again, you should only do it for no more than 3 months at a time, in part because our body goes through these cycles. We should have cycles of building and cycles of breaking down. So during the building phase, we're putting on muscle, we're accumulating tissue, but it is important to break things down because we accumulate cellular debris, and you don't always want to be building indefinitely. So there does need to be this balancing act. All right, the next category is the immune peptides. So what happens to our immune system? Well, it's kind of like Goldilocks. You could either be too hot, too cold, and we obviously want just right. So if our immune system is overactive, we see things like autoimmune disease on the thyroid and our nervous system and our gut, leading to chronic inflammation. Or we can have not enough immune activity. So that's the most classic example is with age. As we get older, we all know that our grandparents are far more susceptible to things like the flu or COVID than those of us who are younger. Shingles is a classic example. So shingles is the chickenpox virus that's living inside of us, but it only emerges when our immune system is starting to decline. Cancer is probably the most obvious example of how important it is to have an active and appropriate immune system, because we all have cancer cells in us right now. And our immune system is what's in charge of preventing those cells from turning into tumors. So why does the immune system decline? Well, a lot of that goes back to the thymus gland. So the thymus gland sits right in our chest above our heart. And what it really is, it's a school for our immune system. This is where the T cells, which are a really important part of our immune system, are made and taught. They're taught what is you and what is foreign, so they know when to attack and when to not. And again, like everything else, the thymus gland shrinks with age, and so we start to see the loss of some of this important information. So that helps explain the rise in cancer, rise in autoimmunity, chronic inflammation, and this problem with infections. So what we want to do is find a way to recreate these thymic signals, and thymosin alpha-1 is one of them. So thymosin alpha-1 is made by the thymus gland, and this is really the main messaging molecule to help train our immune system. And what it does, it makes our immune system smarter. So it's like taking your immune system back to school, giving it a refresher course, helping it identify what needs to be fought, whether it's a virus or a cancer, and what shouldn't be, which is ourself. And it helps us recover from illness. And as a result, especially in other countries, we see thymosin alpha-1 used in a whole host of conditions. Lots of different cancers, psoriasis, hepatitis, pancreatitis. But it's not just a mindless stimulating of the immune system. It's a much more intelligent way to modulate the immune system, so it's not just this overactivation. And as I said, in lots of other countries, it is approved. So this is another case. This is a 32-year-old female I saw who had Crohn's disease. So those of you who don't know, Crohn's is an autoimmune disease that affects our colon, causes these very painful ulcers within the colon, often leads to bleeding, increases your risk for colon cancer. And she could not tolerate most of the prescription medications that her GI doc prescribed. So she came to me and we did hyperbarics along with a set of peptides. So we gave her TB4 to help with healing, thymosin alpha-1 to rebalance the immune system, and then we gave her oral BPC 157 and KPV to help heal her gut. She did amazing. After about a month, her flare had fully resolved, and she continues to do really well. All right, what about the brain and sleep? So we've got lots of different peptides that can help the brain. Cerebral lysine is extremely interesting. It's a combination of 3 different peptides. So that molecule itself doesn't exist within us, but the individual components do. And it's first isolated within pig brains. But what it does is it really protects our neurons, it helps them repair, makes them more neuroplastic, make new connections. And so it can be used, as you can imagine, stroke, heart attack, dementia, concussion. And in Austria, Germany, many other countries, it is actually FDA approved for their regulatory bodies. But in this country, it's not, and access is really challenging. This is one of the few peptides you can't get from a compounding pharmacy, so it typically has to be brought in from out of the country. But I've seen amazing results with it. Other brain-related peptides, I mentioned TB4, dihexa is a capsule, and that is showing a lot of promise in dementia. And Cmax is a nasal spray you may have heard of. A lot of that can be used for focus, especially, so a lot of people have used that. When it comes to sleep, sleep is essential for our brain. When we get into deep sleep, that's when our brain kind of takes out the trash, removes the debris that can lead to amyloid plaques and dementia in the future. And so a lot of us have trouble getting into those nice deep phases of sleep. So if you take a sleeping pill, it puts you to sleep. Alcohol puts you to sleep often, but it doesn't get you into the deep restorative sleep. So we're looking for things that can obviously increase deep wave sleep, and that's what DSIP, or delta sleep inducing peptide, can do. It helps us shift into these deeper sleep phases. And it's a much more natural signal. It's subtle, so it's not like, again, a sleeping pill that's just going to knock you out. But it really can help. It's almost, the analogy would be you're turning off the lights, setting the stage for sleep, as opposed to just sedating you. Epithalin is another great one for sleep, and what I like about that, it only has to be taken once or twice a year, helps reset our circadian rhythm. And I mentioned earlier, growth hormone increase can help us get deep sleep as well. All right, this was a really incredible case of a woman I saw. She was 59, and in 2022, she was involved in a pretty devastating car accident, left her with this severe brain injury. At the time, she was essentially comatose, and the neurologist told her husband, you know what you see is what you get. She's probably going to be a vegetable for the rest of her life. And luckily for her, that her husband was extremely intelligent and quite wealthy, and he decided no. And so he basically made it his life's mission to explore every outside-the-box therapy. So he utilized hyperbarics, a lot of regenerative medicine, took her around the world for stem cells, exosomes, and of course peptides. One of the main ones he relied on was cerebrolysin. He gave IV cerebrolysin several times a week for 3 months, also BPC and TB4. And when I met her about a year ago, this woman's walking, talking, she's living. So it's quite a testament to what peptides can do. All right, what about longevity? So we've got a few peptides that can really act on longevity. Epithalin, as I mentioned earlier, which can focus on sleep. The way it helps longevity is that it increases our telomeres. So the telomeres are the little caps on the ends of our chromosomes, and they get shorter with age. And the problem with that is when you have short chromosomes, every time our cells divide, you're much higher risk of basically mutations and mistakes. And so that leads to cancer and disease. So what epithalin does is it inhibits the enzyme that shortens those telomeres. So it makes our telomeres longer. And this has been extensively studied in Russia by a guy by the name of Dr. Kavanaugh, and he found all kinds of benefits apart from sleep. He saw improved longevity, decreased cancer. And what I like about this peptide is it's relatively easy to use. It's just injected nightly for 10 days, every 6 months, every 12 months. So it's a perfect reset, not only for sleep, but also for longevity. Another longevity one is called FOXO, and this one is what's called a senolytic. Basically, a senolytic helps, again, this concept of taking out the trash. And this is something that periodically we can employ to help improve longevity. I mentioned earlier the GHK copper, the growth hormone peptides, by being anti-inflammatory, antioxidant, they have these inherent longevity promoting qualities. All right, sexual health, obviously very important. And we do have several peptides that can act directly on sexual function. So PT141 is actually FDA approved for this thing called hyposexual arousal disorder that we see in women with menopause. And it's related to this other one called melanotan. So they're both from the same parent peptide, and they act in different ways. PT141 increases arousal, and melanotan, they call it the Barbie peptide because it can increase melanin in our skin, so it actually tans you without the sun. And they both have a little bit of both. So PT141, you can get a slight tanning, and melanotan, you can get a slight increase in libido. Oxytocin is often known as the bonding hormone, the love hormone. This is what is released when we're nurse feeding from our moms. It's released after sex, so it helps to really encourage that bonding. And now we can find these compounds and use them ourselves to try and raise some of these signals. Some pharmacies will even combine them with some of these erectile dysfunction drugs. So there's a lot that you can do with these categories. Energy and metabolism, this is a big one. So metabolism, this is the process of taking the food that we eat, breaking it down, and generating energy. And a lot of people, when they think metabolism, they think weight, and it's true, but it's way more than just fixing our metabolism is so important, is that we are really experiencing kind of an epidemic of poor metabolic health. There's something called metabolic syndrome, which is where we see more weight around our circumference. We see a resistance to insulin, higher blood pressure, our cholesterol numbers get thrown off. And at last check, almost 90% of Americans have at least one component of metabolic syndrome. So it's a huge problem, and it all goes back to the same three failures. Our mitochondria stop working, we stop listening to insulin, and we're chronically inflamed. But wait, we should have a peptide that could fix metabolism, and that's insulin. And while insulin has been game-changing, especially for type 1 diabetes, Type 2 diabetes is different. So in type 2 diabetes, that's insulin resistance. So the cells stop listening to insulin. That's because insulin has been too high for too long, because our sugar's been too high. And it's the only hormonal abnormality that when we have too much of something, our current answer is to give more of that thing. So if you had too much thyroid hormone, the doctor is not going to tell you take more thyroid hormone. But that's essentially what we're doing with type 2 diabetes. We have too high insulin, and yet ultimately the answer is often take more insulin. So it's not a very intelligent way to solve the problem. And so enter the GLP-1 agonist. So GLP-1 stands for glucagon-like peptide. So this is made naturally in our gut, and it's released in response to meals. And it signals many different organ systems. It tells our brain, you're full, stop eating. It tells your stomach, slow down digestion so fullness can last longer. It tells our pancreas, only release insulin if we have high sugar. And it tells our liver, don't just make more sugar. The problem is, for many people, this system, our own GLP, is actually our body no longer listens to it. In large part because we're eating ultra-processed foods that are hyper-palatable, and we're not listening to these natural cues within our body to tell us to stop eating. And if we're just going to rely on natural GLP-1, it lasts 1 to 2 minutes. And so it's like a little tap on your shoulder, okay, you're full, but many of us ignore that tap. And so it really wasn't a viable therapeutic. So nature gives us all the answers, really. In the 90s, scientists who were studying these cool reptiles, the Komodo dragon and the Gila monsters, would note that they would eat a meal and then not eat again for weeks to months, and yet their blood sugar remained really stable. So they were trying to figure out what is happening in their body metabolically that allows them to maintain this stable blood sugar. And they isolated from the spit of the Komodo dragon and the Gila monster this other peptide which inhibits the breakdown of GLP-1. And that's really what led to us using these medications. So we can thank dragon spit for GLP-1s. And so it's gone through an evolution. You know, most of us have heard of Ozempic, which was the first version, semaglutide. So again, that's acting on just GLP-1, helps us feel full sooner, and so we can lead to weight loss. The GLP plus GIP is tirzepatide, also known as Mounjaro. So this is 2 peptides, and this not only helps us feel full faster, but we handle carbs better with this peptide. And then the most recent version, retatrutide, is 3 different peptides. So now you're adding something related to energy use and fat burning. So it encourages our body to burn stored fat. And we're going to basically eat less, burn more fat, and we see much more weight loss. And with each iteration, we've seen more weight loss and less side effects. So how much weight loss are we talking about? So with the first version, semaglutide, the studies show that people could lose up to 15% of their weight. This was after about 40 months of taking it. So in a 200-pound person, this would be 30 pounds. With tirzepatide, Mounjaro, we see 20% weight loss, and retatrutide, the latest version, we're up to 25%. All right, but there's got to be a catch. Now, again, these are manipulated versions of peptides. They're lasting longer. They're combined in a way that our body doesn't naturally do it. So you would imagine you're going to see more side effects than some of the more natural peptides. And probably one of the biggest things we see, you know, the infamous Ozempic face. We've all seen these weird-looking people who look like skeletons, and that comes from excessively rapid weight loss. Our face has these fat pads, and so if you crash, lose weight, you see this sunken look. Naturally, if you're going to slow down digestion, you're going to see side effects related to that. Everything goes back this way, so you're going to bloat, you're going to get heartburn, you're going to get nausea. The bile in our system slows down, so you can get gallstones, you can get pancreatitis. A big issue is that you can lose equal amounts of muscle as fat. So, and a big issue as well is that almost all the studies show that when the patient stopped, they saw a regain of weight. So these are by no means perfect. How can we minimize some of these issues? Really, the most important thing is to start low and go slow. Have patience. So a lot of times the brand name Ozempic or Mounjaro, when you see that starting dose, it's too high for a lot of people. And so what happens is many people are started on the so-called intro dose, and they feel miserable. They're vomiting, they're in the ER, they're having all these complications. And so this is where a lot of people advocate this idea of microdosing. So you could go as low as 10% of the recommended dose and still see a lot of the metabolic benefits without a lot of these issues with excessively rapid weight loss. So what I counsel people to do is to shoot for no more than 2 to 3 pounds a week. So you do have to target that and monitor that. What's great is that we do have a whole host of supplements and natural substances that can help offset some of these issues. To address the problem with muscle loss, relatively simple. You got to make sure you get enough protein. You got to make sure you're doing resistance training. So, lots of people think that, oh, I need to go on one of these just so I can look good in a bikini, as opposed to knowing I still have to eat my protein. I still have to do strength training because otherwise you're going to run into some of those problems. Now, based on what we've talked about, can you think of any other peptides that would help counter this issue with loss of muscle? Mod-SC wouldn't really address the muscle, but it would help improve sugar control. But any of the ones that we talked about that help build muscle? BPC. Yeah, so the growth hormone releasing peptides. But BPC helps address some of the gut issues associated with. So these are a category that do really well when combining with other peptides as well. All right, so Quicksilver is one of my favorite supplement companies. They have this really amazing delivery system where, unlike most supplements that you take and swallow and you have to absorb, they are in liquid form and they're primarily absorbed through the lining of our mouth. And so we have most of these products here at the lab, and they've put together a support bundle, things like digestive enzymes, things that help address a lot of the problems associated. And what's cool about Quicksilver is they've come up with actually a delivery system for oral peptides that is very promising as well. So most patients who are going to start on GLP-1, I always encourage them to consider using some of these. All right, mitochondrial peptides. So MOT-SC is a great, amazing peptide. So this is something released by our own mitochondria, and it helps our body use fuel better. So it basically burns energy when we need it, and you're going to store less excess fuel as fat. And as we age, we get less mitochondria, so that means less MOT-SC. So by taking MOT-SC, we can see improved response to exercise, improved fat burning, better sensitivity for insulin, and really it helps restore our metabolic flexibility. So if you are healthy, you should be able to switch between the different fuels we have. So at night when we're sleeping, we're not eating, so we're in a fasted state. So if you're metabolically flexible, when you wake up in the morning, you should primarily be burning fat. Lots of people, however, their metabolism isn't that healthy, and so they are primarily carb burners only, and that leads to lots of problems. So MOT-SC helps restore this metabolic flexibility. It's not a stimulant, it's not like a weight loss drug, but it really does help fix our metabolism. This is definitely one of my favorite peptides. Another mitochondrial peptide is something called SS31. This is also made within the mitochondria, and it helps stabilize our mitochondrial membrane. So as we age and the mitochondria start to become dysfunctional, think of like an engine that's releasing lots of smoke and leaking things. And so this helps to repair that mitochondrial engine, prevents the leaking of electrons, and protects the engine. And what this is really good, the mitochondrial peptides, they generated a lot of buzz when they first came out because the idea was like, these are going to replace exercise. They're not that good, and so they don't replace exercise, but they mimic a lot of the benefits that exercise does give us. And so what I really love SS31 for are in some of my elderly patients who are unable to exercise for whatever reason. And mitochondrial dysfunction is not only just about metabolism and weight, it really has a major impact on our brain. Our brain has one of the highest amounts of mitochondria. And so conditions like Parkinson's, Alzheimer's, we see ultimately within the neurons, it's a problem with the mitochondria. So I've seen really good results using SS31 in particular with patients with Parkinson's. All right, this is the last case, I believe. So this was a 56-year-old female who was well on her way to diabetes. And so she had weight that she wanted to lose, and so her doctor started her on Ozempic. And again, she started out at the correct starting dose, and she didn't tolerate it. She had lots of vomiting, lots of constipation, and so she didn't do well with that. And so when I met her, we decided to incorporate MOT-SC, BPC and TB4 to help address the gut, and then we switched her to tirzepatide, but at a much lower dose. So I started her out at 50% of the normal starting dose, and we just gradually worked our way up. She did great. So she had more energy to exercise. She ended up losing weight. She's no longer pre-diabetic, so her insulin sensitivity was restored. All right, so it's important to understand what peptides are not. They're definitely not magic, and they don't do the work for us, but they can help make the work more effective. I typically like to show patients this image of the tree of health, I call it, because it really shows the importance of addressing the foundation, the roots, the soil, not just going straight to the shiny leaves. You've got to address the foundation. So what are the foundations of our lifestyle? What we eat, how well we move, how well we sleep, how well we handle stress, what's our relationships to ourselves and others, how is our relationships to our past traumas, and what type of foreign molecules are we putting in our body, be they toxins or supplements. So all of those things, we should all have a solid strategy for each of those 5 roots. And so, I can't tell you how many people I get who come and they're like, I want the brain fog peptide. I want the weight loss peptide. And it's not that simple. You really have to address the foundation, because if you go straight to a peptide, who knows if you're dealing with a major toxin, a major deficiency, a major issue. The response to peptides is going to be limited to potentially not at all. So it's very important to do a baseline look at your health first. And for that reason, lab tests aren't required to do peptides, but I do think they help guide us and show us where do we really need the most support so we can use peptides in a more intelligent way. All right, what about the evidence for these things? Well, it's important to understand that this dichotomy between conventional medicine, which primarily waits for disease to arise and then you treat the illness, usually by symptom control, and what they use to determine is this substance, does it have enough evidence, are these large trials. So you won't see conventional medicine look at many of these peptides, in large part because even though they've been around for a long time, these are molecules that can't be patented, so there's no real financial incentive to study these in large trials. So we're never going to get the large trials that's going to get your PCP on board with a lot of these peptides. They're going to say, show me the evidence, I don't see the evidence, so they're going to dismiss it. But pharma is, to this day, continuing to develop medications from these peptides. We talked about the GLP-1s. Lots of emerging cancer therapies are using peptides. So it's not that these things don't work. It's just that, conventional medicine likely is never going to adopt many of them simply because of the whole profit motive of pharma. So most of us, by definition, we're here at the Biohack Lab. We're more interested in optimizing health, not waiting for disease to arise. And so this field really relies on this whole concept of N of 1. N of 1, a study uses N for how many people are in the study. And the more people you have in the study, the more powerful the study is. But I think it's I think N of 1 data from what we're doing in ourselves, using ourselves as our own research in essence, is very valuable and it's valid data. So most peptides have been studied to some degree, and they've been studied enough to establish safety. What we don't know is a lot of the full definition that some of the larger pharmaceuticals have, which is full dosing, full protocols, a lot of these other questions. So peptides are kind of like straddling this space between natural biology and pharmaceuticals. Very promising. Like I said, will conventional medicine accept many of these things? Probably not. All right, so what about regulatory concerns? Are peptides illegal? The short answer is no. They're not controlled substances. These aren't narcotics. You never go to jail for using peptides. I won't go to jail for prescribing peptides. Where the regulation really comes in is who can make peptides. So the FDA primarily monitors the people who are manufacturing them. And so we've got the FDA approved peptides. Your PCP can write a script to Walgreens and you can get those. But then we've got off-label use of those same peptides. And then we have the compounding world. Now, these are considered legal if the FDA says those labs are being compliant. Unfortunately, in late 22-23, the FDA came down with a pretty draconian rule saying that many of the most popular peptides, BPC-157, thymosin alpha-1, TB4, should not be compounded by these pharmacies because they said there was inadequate safety data. But a lot of people, especially the conspiracy-minded ones, weren't ignorant to the fact that this happened during the pandemic. Thymosin alpha-1, there were some really exciting studies showing it having amazing effects during COVID. And so we all know that during that time there was some shady regulatory decisions made. So the last kind of category would be what are known as research chemicals. Now, these are unapproved. We'll talk about that on the next slide. So where can you get peptides? So in general, we're down to either the FDA-approved ones, getting them through your regular physician, or a compounding pharmacy or a research lab. So compounding pharmacies, there's two types, 503A, 503B, but basically what's good about them is they are following these governing standards on how to do things, because making peptides is, most of the raw materials come from China. The whole process requires use of some very harsh chemicals. So if that process isn't done correctly, you can end up with a lot of impurities, a lot of harmful things in your body, which obviously we don't want. So compounding pharmacies are still ultimately the most vetted way to get peptides. However, you have to go through a doctor, and they tend to be much more expensive. And what happened since 2022 is a lot of these compounding pharmacies were told, squash, you can't make these anymore. And so what many of them have done is they basically close their door. The 503Bs have to be inspected by the FDA on a regular basis, but the 503As do not. And so the way I'm still able to prescribe many peptides through a compounding pharmacy is through some of these 503As who've continued to compound them. And because currently the political climate is not really targeting peptides, they've really been able to expand their production. So they're still very much available, even though technically FDA has said, don't do this. The other category are research peptides. Now, if you talk to me as recently as 2 years ago, I would say, don't ever do this, because this is really wild, wild west, right? You have no way of verifying purity, potency, sterility, and these are direct-to-consumer places, and the way they get around it is they market it as not for human consumption, for research only. This doesn't mean that it's harmful to humans per se, but this is just their way of working around the regulations. Things have changed though. The capitalism in the market makes people adapt to demand, and so consumers have become more savvy and they want testing, they want some certificates of purity. And so there are several of these research labs that will provide that. They'll send their batches out for third-party testing. It's still not regulated, and so that does have some inherent higher risk, but I no longer am so, I can't tell anyone to do this, but I don't think it's the craziest thing in the world, but you certainly have to do your research. All right, so we'll run through a few questions. You guys may have some questions of your own. So a common thing that I get asked is, do all peptides have to be cycled? No. A lot of it is once you understand what a peptide is doing, then you think about, does my body need this signal right now? So in general, though, we don't want to be on these peptides indefinitely for life. We want them to get us where we need to be, and then we go off them. But we can always utilize them. I'm sure I'll always use thymosin alpha-1. I use it anytime my son comes home with a cough or flu, to avoid getting sick, and I haven't been sick in quite a while. BPC 157, I'm sure I'm always going to utilize because it helps with the aches and pains from going to the gym. So there are certainly ones that you can see as being a part of your life indefinitely, but in general, you don't want to be on them all the time. How about oral peptides? We're starting to see more and more some of these formulations coming out as oral peptides, and a lot of this depends. I mentioned Quicksilver has a line that seems to be really effective. My experience has been they're definitely not as potent as the injectable versions, but things are changing. We now have transdermal peptides, these patches that can work, and those seem to be very promising. So I think that's going to continue to evolve. But currently, definitely still the most reliable way to get these messages into your body is still injection. And a common question is, can they be stacked together? And so, again, the answer depends. There are certain peptides that really have different pH preferences. So GHK copper likes a certain pH, TB500 and BPC like another pH. And so one of the common, criticisms of the Glow blend is that, well, wait, these three really don't have the same pH preference. Why are you mixing them all together? Once I learned that, I have a preference of kind of separating out GHK copper. BPC and TB5 are very compatible on a pH standpoint. So it really depends. In general, so you're not sticking yourself 4 times every morning, I think most people in the field would accept that you could draw them up into one syringe, and inject them. But you can't draw them up into a syringe, put the syringe on the counter, go make breakfast, because certainly they're going to degrade and start to interact. So in general, they can be taken together, but again, a lot of it depends. A lot of people say, hey, if we're stimulating new blood vessel growth, if we're stimulating growth in general, can't they cause cancer? And again, this is a much more nuanced conversation, and there has never been a single case of cancer that I'm aware of that's been demonstrated and linked back to peptides. That said, there are certain peptides that I still avoid in patients who have active cancer. The main ones are going to be the growth hormone peptides. Some people say BPC 157 and TB5, since they stimulate angiogenesis, which is new blood vessels, and many cancer drugs block that. But they used to say the same thing about hyperbarics, that it stimulates growth, it's going to cause cancer. That has been put to rest a long time ago. So I think we're going to see the same thing with peptides. Thymosin alpha-1 definitely, I think, can play a major role in cancer. There's several other peptides that can have a potential role. So right now it kind of depends. And lastly, can you combine peptides with other therapies? Absolutely. So, some of the cases I outlined, many of them, we were doing hyperbarics together with peptides. I've seen great results with regenerative medicine therapies, things like stem cells, exosomes with peptides. Most of the modalities here at the lab synergize extremely well with peptides. So yes, absolutely, it makes sense to combine them. Lots of places to learn about peptides. This is changing all the time. The book on the left is by Dr. Edwin Lee. He's amazing. He's one of my mentors. It's a very layperson friendly book. It's a perfect introduction to peptides. And then as you progress, the Peptide Handbook by Dr. Laval is another great one. That's a little more, it's oriented towards providers, but the layperson could certainly understand it. It helps you really understand protocols, dosing, etc. Dr. William Seeds is another big person in the peptide space who's got several books as well. Some amazing people online. Like anything, you got to vet your sources. Not every influencer is going to give you the correct information about peptides. I would prefer that you are going to be under the guidance of someone who's actually trained in them. But again, I didn't learn this in medical school. None of your doctors did. So it really requires a provider who's kind of an outside the box thinker, who's curious, who's willing to learn these new emerging therapies. All right. So what essentially are peptides? Like I said, these are molecular copies of our body's own signaling molecules. And so it can really help address these key failures that lead to disease. It can help fix our energy problem, fix our insulin problem, fix our inflammation. And ultimately, they're going to amplify, upgrade our biology, and improve our health. So that is it. I don't know if there's any questions.